Phosphodiesterase Type 4 inhibitors, also known as PDE-4 inhibitors, are medications that block phosphodiesterase 4, also known as PDE-4. PDE-4 is an enzyme with 4 subtypes: PDE-4A, PDE-4B, PDE-4C, and PDE-4D. PDE-4A is primarily located in the brain, skeletal muscle, and male reproductive organs. PDE-4B is primarily located in the lungs, immune cells, and brain. PDE-4C is primarily located in male reproductive organs, skeletal muscle, kidneys, and immune cells. And PDE-4D is primarily located in the brain, immune cells, male reproductive organs, kidneys, and vascular tissue. While all 4 PDE4 enzymes are inhibited by PDE4 inhibitors, it is their effect on PDE4B that is clinically significant. PDE4 normally breaks down cyclic adenosine monophosphate, or CAMP, a secondary messenger molecule crucial for cell signal transmission. By inhibiting PDE4, the breakdown of CAMP is reduced, leading to increased levels. Elevated levels of CAMP in the lungs suppress inflammatory molecules. This results in reduced airway inflammation. Elevated CAMP levels in the lungs also cause smooth muscle relaxation, leading to bronchodilation. Elevated CAMP levels also regulate mucus secretion, helping to manage excessive mucus buildup. Elevated levels of CAMP in immune cells result in a decrease in the production of inflammatory molecules and an increase in the production of anti-inflammatory molecules. This elevation of CAMP also causes immune cells to become less reactive. The overall result is a shift from a pro-inflammatory to an anti-inflammatory state. Lastly, elevated levels of CAMP in the brain enhance neuronal communication, increasing the ability to learn and memorize, and help regulate mood and behavior. The most common PDE4 inhibitors are Roflumilast, Apremilast, and Crisaborole. To help memorize PDE4 inhibitors, it can be helpful to remember that many, but not all, end in milast. PDE4 inhibitors are primarily used to treat conditions related to chronic inflammation and an overactive immune system. Roflumilast is primarily used for severe chronic obstructive pulmonary disease, or COPD, to prevent flare-ups and exacerbations. However, it's important to note that Roflumilast is not intended to treat acute onset of shortness of breath or bronchospasms. This is because they do not provide immediate relief. Instead, Roflumilast works by reducing inflammation over time, with the primary goal to prevent flare-ups rather than treating them. A rescue inhaler, such as albuterol, should be used for acute shortness of breath. Apremilast is primarily used to treat psoriatic arthritis, plaque psoriasis, and oral ulcers associated with Behçet's disease, a rare autoimmune disease characterized by chronic inflammation of blood vessels. Crisaborole is a topical medication primarily used to treat mild to moderate atopic dermatitis, which is the most common form of eczema. Currently, PDE4 inhibitors are not used for their effects on the brain. However, this is an active area of research. Adverse effects of systemic PDE4 inhibitors can include nausea, diarrhea, headaches, weight loss, decreased appetite, insomnia, mood changes, such as depression and suicidal ideation, angioedema, and flu-like symptoms, such as muscle aches and general malaise, or a general feeling of unwellness. Adverse effects of topical PDE4 inhibitors, such as Crisaborole, can include burning, stinging, itching, and redness at the application site. Roflumilast should not be used with moderate or severe hepatic impairment, as the liver metabolizes it. During therapy with systemic PDE4 inhibitors, such as Roflumilast and Apremilast, weight should be monitored regularly to monitor for significant weight loss. If a significant weight loss is noted, the MRP should be notified, as this may necessitate discontinuation of the medication. In addition to this, it is also important to monitor mental status throughout treatment, particularly for suicidal tendencies. When administering Roflumilast for COPD, A respiratory assessment should be completed, including lung auscultation, respiratory rate and effort, oxygen saturation, sputum color and character, and the number and severity of exacerbations. When administering Apremilast for psoriatic arthritis, a joint-focused assessment should be completed, including joint pain, deformities, stiffness, swelling, and range of motion. Gait, posture, and muscle strength should also be assessed. When administering Apremilast for plaque psoriasis, a skin-focused assessment should be completed, including characteristics of skin lesions and their extent and severity, using an applicable measuring scale, such as the Psoriasis Area and Severity Index. If administered for Behçet's disease, oral ulcers should be assessed. And finally, when administering Crisaborole for atopic dermatitis, the skin should be assessed for the lesion's characteristics, such as whether they are dry, open, bleeding, the areas affected, and whether they are itchy or painful. Systemic PDE-4 inhibitors should be avoided with CYP3A4 inducers, which are medications that increase the activity of the CYP3A4 enzyme, such as phenytoin, an anticonvulsant, and rifampin, a potent antibiotic. CYP3A4 plays a significant role in the metabolism of PDE-4 inhibitors. Therefore, concurrent use can reduce blood levels of PDE-4 inhibitors, which decreases their effectiveness. Systemic PDE-4 inhibitors should also be avoided with CYP3A4 inhibitors, which are medications that decrease the activity of the CYP3A4 enzyme, such as erythromycin, an antibiotic. Concurrent use can elevate blood levels of PDE4 inhibitors, which increases the risk of adverse effects. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!